are your local law firm.
A 20-year anniversary is something to celebrate for sure, and our next guests are very proud of the 20 years of service that their organization has brought to the Chattanooga area. Joel Henderson, Bailey Frable are here. They are with Volunteers in Medicine. Good to see you both.
Well, thank you.
Congratulations. 20 years y'all have been helping
20 years.
the uninsured in our area find primary care health coverage. Is that right?
That is correct. I mean, for those folks who otherwise would have nowhere else to go for care in our community, that's what Volunteer Medicine has for 20 years and continues to provide. And once again, what sets us apart is once patients go through our eligibility process, we never ask, how will you pay for your care today?
So y'all are having this event coming up. It's always nice to hear something kind of in theory, but then when you can see a proof of performance, so to speak, that's very powerful. So y'all are having the second annual awards luncheon that kind of showcases, Bailey, the work that you do.
Yeah, so at the luncheon, we're going to honor a couple different people that really are the components of Volunteers in Medicine. So we're going to honor a longtime volunteer and actually the founder, Nancy Franks. We're also going to be honoring a patient of hope. She'll be on stage. We'll be doing fireside chat interviews with everybody there. And then we'll also be honoring a longtime community partner, the Weldon Osborne Foundation, and that'll be Barbara Martyr there to represent. So we're really excited.
I did not vet this question before I'm asking it, so sorry. But as a general rule of thumb, if a person comes to you and they need primary care access, a doctor, and they're going to need that care then ongoing, right, for the course of a year. So is there a dollar figure associated with how much money y'all spend a year on helping people?
Absolutely. So it's roughly around $1 million a year for their primary care support in our clinic. And then also the medications. Think about you being diagnosed, now what do you do? So we have a prescription assistance program, also $1 million a year. Now take that, if that's okay, multiply that out for 20 years and think about that.
Yeah.
For the 82,000 patient visits that we provide in our primary care setting, no different than your own doctor's office, that I hope everyone watching this has, or if they don't, tell a friend and neighbor about us.
Yeah.
And how that really continues to multiply. So those are real costs. Even though we don't ask our patients to pay, that's $14 million if we were to actually look at that as far as what those costs over the lifetime. It's just, it adds up very quickly.
So that is a high dollar figure, but would I be right in doing like the budgeting financial wisdom here that you're outputting this $1 million a year to help people who otherwise wouldn't have the medical care? But in the doing so, you're either catching things early, you're preventing things from growing in severity, which then is a huge cost savings down the road. Plus, they're healthy, happy people.
Well, I always say it's priceless. I mean, think about that as, this is a component of workforce development. We're helping people either get healthy, get those jobs, keep those jobs, and it really keeps a more vibrant community that we all live and serve. And
do you have just the one clinic or multiple?
we have the one, but keep in mind that I always give Krispy Kreme a shout out, give us some free donuts. If they can find their way over to the Eastgate area, that's where our clinic is located, right by the public library.
Yeah, so when they're there, are you seeing children as well as adults?
So we have many wonderful community partners we can refer to. Our focus is 19 to 64, so it's adults.
Okay, so Bailey, you're on the development side of things, right, for the organization. When you go and you find yourself talking to people, hoping that they'll join you in this effort, are they just overwhelmed by the work that you do?
Yeah, I think especially in today's age, anything free is pretty much unheard of, and I feel like a lot of people think that it's too good to be true, but we just had a patient come in and she was really moved by the care that she received, and she was like, I just want to shoot it from the rooftops that y'all are here. Like, I don't know what I would do after losing her job that she had.
Right.
And a lot of our patients are choosing between groceries and like medical bills.
Right.
And we want to kind of come in and eliminate that worry.
Yeah, if you've been lucky enough to never have to walk that walk, say a prayer of thanks tonight, but it's very frightening if that's where you are in your life. And it can be also sort of demoralizing to be there and to know that people are there to help you is great.
Yeah.
So at the luncheon,
Yes.
that's a celebratory thing, right?
It is.
And it's also a fundraiser though, right? Because the tickets in keep this going.
Well, we always say it's a friend-raiser and a fundraiser because that continues to keep that going. So even the event, letting you know, Dr. Mutter, our medical director, he purchased the last table. So the event is in wonderful full capacity as we go into the event.
Okay.
However, there's opportunities that they can continue, if people want to support the community, to make those donations today that helps our patients tomorrow and moving forward.
And just a shout out, I guess, to the physicians in our area.
Yes.
Oh, yeah.
I mean, they aren't all directly involved with you at Volunteers in Medicine, but I'm sure their support is there.
They are, and we could definitely always continue to have the next generation of providers. We have over 100 volunteers. Otherwise, we could not do what we do. They are truly the heartbeat and the soul, working alongside our small but Herculean little staff.
So if you want to get in touch with them, whether you might be somebody who does need this care, they are there to help you with a warm and welcoming smile. Do they make appointments, by the way, by calling in or going online?
Just
or?
traditional doctor's office. So
Okay.
you make your appointment either at the time of your first visit or moving forward for every of your doctor's visits.
Okay.
And to also remind folks, we are continuing to accept new patients. So if they can call in, go to our website, learn how to become a patient.
Okay, that's what you'll do. So here's the information. The luncheon basically is sold out.
Yeah.
But you can be very envious if you don't have your ticket on April 23rd, knowing all those people are at the Marriott enjoying a very nice meal and a great afternoon. But vim-chat.org is the website, Volunteers in Medicine. And if you would like to support them any time of the year, they would welcome it. Thank y'all.
Thank you.
Thank you.
You wake up, clock in, and put in a hard day's work. But what happens when an ordinary workday takes a turn for the worse? If you were injured on the job and feel like no one has your back, we do. Give us a call. It's more to us. It's personal.
The Chattanooga Men's Clinic opened in 2021 for guys who get it done. Let's talk, fellas. You solve problems all day at work.